A tiny clove of garlic can affect your blood pressure, your heart, and your blood circulation more than most people realize. But the shocking part is this: garlic's real power does not begin when you swallow it. It begins when you crush it, chop it, or chew it. If you are swallowing garlic whole, you may be missing the very compound that makes it useful in the first place. If this kind of senior health guide helps you, subscribe now, because the first change starts before the garlic even reaches your stomach. Change number 1: your blood vessels may loosen their grip. Think of your blood vessels like garden hoses. When the hose is stiff and tight, pressure builds. When it relaxes, blood can move with less force. Garlic may help this relaxation process. One reason is connected to sulfur compounds, including allicin, which forms when garlic is crushed or chopped. These compounds may support nitric oxide pathways in the body. Nitric oxide is one of the signals that tells blood vessels to relax. This does not mean one clove of garlic acts like a blood pressure pill. It means garlic may gently support one of the same body systems your blood pressure depends on every day. For a senior, that matters in ordinary moments. Standing up from a chair, walking to the bathroom in the morning, climbing a few stairs, carrying groceries from the car. Blood pressure is not just a number on a screen. It is pressure moving through vessels that feed your brain, heart, kidneys, and legs. But here is the useful twist. Garlic works best as part of a pattern, not as a rescue trick. Eating garlic one day, then forgetting it for a week, is different from using it regularly in meals while also watching salt, movement, sleep, and medication timing. That is why the next change is where many people get confused. They expect garlic to crash blood pressure. The better question is whether it helps the number drift in a better direction. Change number 2: the top number may move more than you expect. When people talk about blood pressure, they usually mention 2 numbers. The top number is systolic pressure. It shows the pressure when your heart pushes blood out. The bottom number is diastolic pressure. It shows the pressure when your heart rests between beats. After 60, the top number often gets more attention because arteries can become stiffer with age. Stiffer arteries do not stretch as easily, so the heart has to push against more resistance. Garlic may have a modest effect on both numbers, but many studies pay close attention to the top number. That is the number many seniors see creeping upward at home: 132, 145, 158, sometimes higher in the doctor's office. The important word is modest. Garlic is not a switch. It is more like a small daily pressure valve. In people with high blood pressure, garlic supplements in research have sometimes lowered readings by a small but meaningful amount. In people with already normal blood pressure, the effect may be much smaller. This is why 2 neighbors can eat garlic every day and notice different results. One person with high readings may see a clearer change. Another person with normal readings may only get flavor, heart-friendly compounds, and no dramatic number change. And that is not failure. A food does not have to create a dramatic drop to be useful. Sometimes the real value is helping a heart-healthy routine become easier to follow because food tastes better without relying on extra salt. That brings us to the everyday mistake that can erase the benefit before garlic ever has a chance. Change number 3: you may use less salt without feeling punished. Most seniors do not get into trouble because one meal tasted salty. The problem is the daily pattern: salty bread, salty soup, salty sauces, salty snacks, and then another salty dinner. Garlic can help because it gives food a strong flavor without needing as much salt. A bowl of vegetables with garlic, lemon, herbs, and olive oil feels very different from plain steamed vegetables. A soup with garlic, onion, pepper, and herbs can taste full even when the sodium is lower. This matters because salt pulls water into the bloodstream. More fluid in the blood vessels can mean more pressure against the vessel walls. For someone already dealing with high blood pressure, heart failure, kidney problems, or swelling, that daily sodium load can matter. Garlic does not cancel out a salty meal. That is the trap. If someone eats garlic bread with salty cheese, salty soup, and processed meat, the garlic is not the hero anymore. It is just sitting inside a high-sodium meal. The better approach is simple. Use garlic as a replacement flavor, not an add-on to a salty plate. Add it to beans, lentils, fish, chicken, vegetables, eggs, or homemade soup. Let it take over some of the job salt was doing. This is the change many people actually feel first. Not a sudden blood pressure miracle, but better meals that make the low-salt routine less miserable. Now the next part is quieter, but it may be one of the biggest reasons garlic gets attention for heart health. Change number 4, your arteries may face less daily stress. High blood pressure is not only about force. It is also about the condition of the vessels receiving that force. Imagine pushing water through a clean, flexible tube. Now imagine pushing it through a tube that is stiff, irritated, and narrow. The same pump has to work harder. Garlic contains compounds studied for antioxidant and anti-inflammatory effects. In plain language, that means garlic may help reduce some of the daily stress that affects blood vessel function. It does not scrub arteries clean. It does not melt plaque. It does not reverse years of damage by itself. But it may support a healthier environment inside the blood vessels, especially when it is part of a pattern that includes vegetables, fiber-rich foods, regular movement, and not smoking. This matters because seniors often only think about blood pressure when they see a reading. But the reading is the result of many hidden forces: vessel stiffness, stress hormones, kidney function, sodium balance, sleep quality, medication timing, and weight. Garlic touches only part of that picture. That is why it is useful but not magical. And this is where many videos get it wrong. They make garlic sound like a natural replacement for a prescription. That is dangerous. If your doctor gave you blood pressure medicine, garlic is not a reason to stop it. It is something to discuss, especially if your readings start changing. The next change explains why the form of garlic matters more than most people think. Change number 5, crushed garlic is not the same as swallowing it whole. Here is the small kitchen detail that changes the story. Garlic releases important compounds when the clove is crushed, chopped, or chewed. If you swallow a whole clove, you may not get the same effect, and your stomach may not thank you either. A simple method is to chop or crush the garlic, then let it sit for a few minutes before cooking. This gives the chemistry time to start. Then you can add it to food near the end of cooking if you want a stronger flavor, or earlier if you want it softer and gentler. Raw garlic is stronger, but stronger is not always better after 60. Raw garlic can irritate the stomach, trigger heartburn, worsen reflux, or make some people feel bloated. If someone already struggles with acid reflux at night, a big raw garlic habit may make sleep worse. That matters because poor sleep can raise stress hormones and make blood pressure harder to control the next day. So the goal is not to punish the body with the harshest version of garlic. The goal is to use garlic in a way you can tolerate consistently. For many seniors, cooked garlic in meals is easier. Roasted garlic, garlic in soup, garlic with vegetables, garlic in lentils, garlic with fish, or garlic mixed into a homemade dressing may be more realistic than chewing raw cloves every morning. But supplements are a different story, and this next section is where safety becomes serious. Change number 6, your medication routine may need extra attention. Garlic in food is one thing. Concentrated garlic supplements are another. A supplement can deliver a much stronger and more consistent dose than a normal meal. That is why research often uses tablets, capsules, aged garlic extract, or specific garlic preparations. It is also why supplements deserve more caution. If you take blood thinners, aspirin, clopidogrel, warfarin, or medicines that affect bleeding, garlic supplements may increase bleeding risk. That can show up as easy bruising, nosebleeds, bleeding gums, or bleeding that takes longer to stop. If you are already on blood pressure medicine, concentrated garlic may also add to the pressure-lowering effect. For some seniors, the problem is not only high blood pressure. It is pressure dropping too low when standing up. That can mean dizziness, weakness, or a fall on the way to the bathroom. Do not stop medication on your own. The smarter move is to bring the full list to your doctor or pharmacist: prescriptions, over-the-counter pills, vitamins, and garlic supplements. Ask one direct question: is garlic safe with my blood pressure and bleeding medicines? This is not fear. This is control. Seniors are often taking several medicines, and the danger is not garlic by itself. The danger is not knowing how garlic fits into the whole medicine cabinet. Now, if garlic can help, when would you notice anything? The answer is not one meal. Change number 7. The pattern matters more than one reading. Blood pressure changes all day. It rises when you rush, worry, climb stairs, drink caffeine, feel pain, miss sleep, or sit in a doctor's office. It can fall after rest, medication, hydration, or a calm meal. So if you eat garlic tonight and check your blood pressure once tomorrow, that one reading may not tell you much. The better method is to watch a pattern. Check at the same time of day, sit quietly first, keep your feet on the floor, and write the numbers down. Do this for several days if your clinician has asked you to monitor at home. Then you can see whether your routine is helping or whether the numbers are still running high. This is where garlic becomes part of a bigger picture. Maybe your readings improve because garlic helped you eat less salt. Maybe because you cooked more meals at home. Maybe because you became more aware of your routine. The number does not care which habit gets the credit. It only shows the pattern. And if your blood pressure is very high, do not try to solve it with food experiments. If a reading is over 180 or 120, recheck after a minute. If it stays high, call your healthcare professional. If it comes with chest pain, shortness of breath, weakness, numbness, vision change, back pain, or trouble speaking, call emergency services. That safety line matters because garlic is a food. A crisis is a crisis. Change number 8. Your heart-healthy meals may become easier to repeat. The best blood pressure habit is the one you can keep doing when life is normal. Not for 3 days. Not only when you are scared. Daily. Garlic helps here because it makes simple food feel less boring. Beans with garlic. Yogurt sauce with garlic. Chicken with garlic and herbs. Fish with garlic and lemon. Vegetables with garlic and olive oil. Lentils, soups, brown rice, salads, eggs, and roasted potatoes can all become more satisfying. That satisfaction matters. Many seniors know what they are supposed to eat, but the food feels plain, and after a few days they go back to processed meals. Garlic can make the healthier plate feel like real food again. But keep the serving realistic. 1 or 2 cloves in food is very different from forcing down large amounts raw. More is not always better. The body does not reward punishment. It rewards consistency. And if garlic gives you heartburn, stomach pain, or a sour taste at night, use less, cook it longer, or avoid taking it close to bedtime. A habit that ruins sleep can quietly work against blood pressure. So what happens to your blood pressure when you eat garlic every day? For some people, especially those with high readings, it may move slightly lower. Your blood vessels may relax a little better. Your meals may need less salt. Your heart routine may become easier to repeat. But the real lesson is this: garlic is a helper, not a hero. It supports the system. It does not replace your doctor, your medication, your blood pressure log, your movement, or your sleep. Use it wisely. Crush it, cook it, enjoy it, and watch your pattern. Because after 60, the goal is not chasing one perfect reading. The goal is staying steady, clear-headed, and independent for as many mornings as possible.